And as I was explaining, the cases that I've over the past 2+ years I've heard are routine, in which my education, my background is capable of comprehending. These new laws, which pertain to face coverings and COVID, are new, and I'm trying to get a sense from you folks on your perspective in issuing penalties for those people that come in to a business without a face covering, and want to hear personal experiences. And I had my first couple of cases that I had to. One was we adjourned because all the evidence wasn't there. One I ruled on, and I just want to get your perspective on that ruling. So moving forward, because I know Eileen O'Connor has a number of other cases coming in front of me, your perspective on that new face covering law that the health department has been very difficult. They're in a very difficult predicament after the hearing the testimony from the inspector, going into a business to observe workers and patrons interacting with potential no face masks, no face mask wearing. So that's why I'm joining you today, just to hear that. And I probably should have joined a long time ago, just so you knew who I was.
Well, we know the name. We just haven't, at least I hadn't met face with it yet. So it was nice to meet you.
Well, yeah. Likewise. Eileen and I worked together for many, many years when I was, I managed the solid waste and water program, environmental programs at the Department of Environmental Conservation. And, so Eileen and I worked on many cases in which we tried to resolve some pretty hefty environmental issues, everything from septic tank discharges into Owasco Lake to HABs, the harmful algal blooms going on Owasco Lake, to manure spills. So we have a long history.
My time's kind of tight today. Are we ready to start the meeting?
I think we should try and start. Megan, are we expecting anybody else?
I'm not sure if Kath. I'm not sure if Kath. I think she might be on her phone.
No, I was just on a meeting with Kathleen, Aileen, and ahead of this. So she told me to. I'm jumped on. And she said she'll be joining us shortly.
Okay, I thought she looked like she was on her phone. Yeah.
Okay, then. I guess we'll call the meeting to order, and we'll start with the approval of minutes from the October 20th meeting. Does anybody want to motion approval?
I'll move it, Daly.
I'll second that.
Okay. Any opposed? Okay. All righty. I guess we'll start with Janine.
Okay. The credit card batch of 9/29 to 10/14. The Children with Special Healthcare Needs grant purchased some brochures for like how to deal with temper tantrums for your children and development for the kids in that program. All kinds of brochures for 40120. On the credit card batch of 1029, we purchased breast pumps from Medela for $1,557.96. On the credit card batch of 1116, we paid the EPA $480. On the warrant of 10/20/20, We bought some vaccines from Santa Fe Pasteur. We also paid Schneider Laboratory for a bunch of lead analysis tests. We've been doing quite a few of those, and we sent out lots of those. On the one of 11/3, we paid Finger Lakes Migrant Healthcare for some STD treatments. And we also began paying Kelly Services for some temporary help to alleviate some office staff in the health department for COVID-related activities. And we also sent out more lead analysis. That's all I have. Anybody have any questions on the bills?
I'll motion to approve.
I'll second.
Okay, thank you. So we'll accept the claims and we'll move on to Tanya.
Can I interrupt? This is Eileen O'Connor. We do have someone here who wanted to speak to the board. And usually in the past, we put them on first. So we have Ryan Moon. I see that he's on. And he's with Ed and Jean's Market. And there was a hearing this past month, and I know he's here to talk about the hearing. So I can give you, if it's okay, I can give you kind of an update from our perspective, and then Ryan can discuss from his perspective. Is that okay, Dr. Kosakoff?
Yeah, that's perfectly okay. Go ahead.
Okay. So
I'm sorry. Excuse me just a second. I'm getting a lot of feedback. Is anyone else experiencing that? It must be just me. Sorry.
Okay. All right. So we had a hearing on November 5th with Ed and Jean's, in that employees at their facility were observed not wearing adequate face coverings while being within less than 6 feet from others. And as it came out at the hearing that these two employees were not wearing face coverings. They were within less than 6 feet of each other, but they were cousins. And Mr. Moon felt that that was an important part of the evidence, I guess. But the Part 66-3 of the New York State Sanitary Code says that any employee who is present in the workplace shall be provided and shall wear a mask or face covering when in direct contact with customers or members of the public, or whenever unable to maintain social distance. And then it says a person shall be considered as maintaining social distancing when keeping at least 6 feet distance between themselves and any other persons other than members of such persons' households. So it was determined that these two people who are cousins, who work in the meat department at Ed and Jean's, were less than 6 feet from each other without wearing face coverings. And so the hearing officer decision was that he should be fined $500. So, Mr. Moon, do you want to present whatever you want to the board?
Well, I just don't understand how, two cousins, I mean, it doesn't matter. Who cares if they live together? I mean, it doesn't make any sense that two cousins can't sit there and talk to each other. But
Mr. Moon, can you hear us?
Yeah, I hear you.
We were wondering if you have anything that you wanted to present to the board since you're at the meeting today.
Yeah. Can you hear me?
I can hear you.
Yep.
John, are you unable to hear him?
I am unable to hear him.
Yeah, I hear fine.
I've got him. That's too bad. I don't know what to do about that. Is there a volume control that we can?
Nothing that I can do about it. I'll let you guys, I guess, if who else can hear? Is there anybody else besides me who can hear him?
No.
Okay,
Yeah,
then
just Keith, I can
I'll leave
hear.
it to you guys. Thanks.
Okay, so go
I go
ahead. Yeah.
Well, I just don't understand how, how two cousins, it's no different than, so if we put that in position, because this is a family owned store, if we took them two cousins and it was a mother, or me and my father, it just makes no sense that, we got to have masks on when we're sitting there, when it's, me and my father, if we're not living in the same household. It makes zero sense. But if you take a different setting and put us at a table and chair with some food, it's quite all right. That's the gray area that, I don't agree upon, and there's nothing to distinguish, something like that. It just, here's the fine, you guys were without a mask, and be about your day. Not to mention, we already got fined for $50 for a customer not having one that we're supposed to control, which that's not going to happen either. That's not even feasible. So I just don't understand how, you guys keep levying fines over these things that, the governor hands down, but yet the gray area, there's no answer to the gray area except for here's the fine. I mean, it's asinine.
Wait,
It had no bearing on, these violations weren't even involving customers. It was involving family. The first instance, I told them that there was a mother and daughter that were up front. They didn't have their mask. It was below their nose, which I clarified that for them, and that's okay because they live in the same household. But you got two cousins out back. They don't live in the same household, so that's a $500 fine. Well, $2,000, but it got dropped down to $500.
So these guys were in the back room. Is that correct?
Yeah, they weren't even out in the public. They're on the side in the meat department.
No, that they were not in the back room. I mean, they were definitely observed.
On the side.
They were definitely observed by my inspector. So they were there within the store.
Okay. Do they put masks on when a customer interacts with them? Do they put masks on?
Yeah, that's why I had stated that in our hearing. That if we wait on customers, everybody has to put on a mask. I told the meat department is that's another gray area because, we're dealing constantly with raw meat. And the last thing you want to do is, constantly touch your face, remove your mask, you got to answer the phone, you got to answer deli, you got to change your gloves, it's not feasible. I mean, you're cross-contaminating, and the number one thing that, our state inspector dwells on is cross-contamination. And what are you going to do when you have something over your face that, for one, you're not used to wearing, and you're touching chicken, you're touching pork, you're touching beef, then you got to go cut deli? I mean, all that stuff is on your mask.
May I ask a question? When you receive the first $50 fine, part of the idea when these regulations were approved was that there would be an educational component. Can you tell me what was said to you after the first $50 fine?
Nothing was said. We got a letter in the mail saying that we came in at such and such time, saying that an inspector came in and was within 6 feet of a customer, didn't have a mask on. Here's a $50 fine.
During the course of many, many months, I have personally provided a lot of education to Mr. Moon over the telephone. We've talked even, I think, way back in April. We have received numerous complaints from many people in the public regarding not wearing masks. And I've had conversations with you, Mr. Moon, many times about this prior to the first consent order that was signed.
Yes,
and I think there was just a disagreement on philosophy in our conversation. And so when we did the inspection, my staff, noted what they saw, which were people not wearing masks within 6 feet of each other. So, and I guess that's where the question comes up is, does that make a difference to the board that these employees were less than 6 feet from each other and they are related to each other. They don't live in the same household, but they're related to each other. So they choose not to wear, their choice would be not to wear a face covering. And does that make a difference compared to other people who work together but are not, living in the same household? So I think that's where the issue lies. So I don't know how you want to make a decision on that hearing officer's decision.
Mr. Moon, is it your intention, regardless of the determination of this hearing, that your employees will not be mandated to wear a mask?
No, I said in the meat department because of the cross-contamination concern. That is the cross-contamination is my biggest concern. All the cashiers up front, they wear them. The people out on the floor, they wear them. It's the people in the meat department that I worry about them getting some sort of, cross-contamination problem from constantly touching their mask. I mean, that's my biggest concern. I mean, that should be everybody's main concern.
And wash their hands in between these activities that you are describing?
You still have the intention of moving the, what if the mask slips down? I mean, it's just a common thing to, move it up with your hand. I mean, unless you're in the position and how you do it all the time, you can't understand how it works.
I am in the position to wear a mask and
I'm talking about cutting meat, dealing with raw meat, chicken.
As soon as someone had an itchy nose and rubbed their nose, they would go and remove their gloves and wash their hands. And adjusting the mask is a no further behavior than that.
I'm curious about how other markets manage this. This mandate is for everyone in that sector of the economy. How do other markets manage to do this if it's not possible?
We're still a butcher too. I mean, all our stuff does not come pre-packed. We cut our meat from scratch every day, all day long.
Eileen, can you talk to your experience on this?
It doesn't involve us taking it out of a box and throw it on the shelf.
Well, our experience is, I'm not that familiar with a lot of butcher shops, so I can't really say. I do know many stores comply and many don't. Stores haven't complied with, which I brought, to you guys as consent orders, and I have a whole slew to bring today as consent orders. So, I really can't comment on.
Eileen, would a shield be in compliance in addition to a mask? Could you wear one or the other?
Yes, a face shield is considered acceptable.
That would certainly be less worrisome in terms of adjusting it over your nose and all of the concerns that are being portrayed.
But it also clogs up.
Yeah, it seems like there's a conflict between the requirements for a butcher with respect to contamination and cross-contamination and cleanliness, and the mask mandate, which admittedly people touch their masks very frequently, like probably 2-3 times a minute without even thinking about it. And so there's a conflict here between what we're asking them to do and what the hygiene people from the other side of the fence ask them to do.
Well, I just don't understand how it's possible for supermarkets, Tops cuts its own meat, Wegmans cuts its own meat. How could they do it when someone else can't do it? And I just don't, I could understand how difficult this is. What I'm failing to understand is why it's good for the goose, but not good for the gander.
And I can speak that in restaurants that do handle uncooked food, uncooked meat, as they're preparing it, we have many restaurants that are in compliance as they handle, uncooked meat, prepare it and serve it. So that doesn't seem to be a problem for many restaurants that we have in our county.
They're in the back cooking. They don't deal with the public. We have to answer the phone. We have to talk to them outside the the meat room. We have to get deli. We have to grab the hot food case. So there's always, situations where it allows us to touch our face mask.
What trouble?
It'd be different. It'd be different if we were if our butcher was enclosed and all we did is cut meat, wrapped it, and then be done with it. But we bring it out to the case. We wait on deli. We do it all.
Not to minimize any issues that small businesses have, and I sympathize. I come from a family that ran small businesses, so I understand. What troubles me is that the more we learn about how meat cutters have been devastated by COVID, it's concerning to me that everyone, including the employees and the public, need to be protected.
Yes, this is Nancy. And, I know this is really difficult to these new behaviors, to learn and incorporate them in our work. But we do need to protect these workers. And it really depends on a fitting mask. And this has been done for years and years and years. Think about surgery. People that have done surgery over the years have worn a mask all day long. And they're not touching their mask all the time. And I do believe it is correct what's being said here, how often people touch their mask, because they're not well fitted. And that reduces the functionality of the mask as well. So I encourage wearing the mask, and we must protect those persons that provide this very valuable work, and that is by wearing a mask.
I'm intrigued by the face shield concept. Do you think that would work, Mr. Moon, the face shields?
No, because you're fogging up, and you got a knife in your hand. You don't want to be able to see what you're cutting.
No, right.
Yeah. No, it definitely won't. It's no different wearing a mask with glasses on.
I have something I would like to say. I'm not a lawyer and I'm not a politician. I'm a doctor. I spent my entire adult life training and then taking care of people in this community. I have missed Thanksgiving and Christmas. I've missed birthdays and baseball games and first days of school and more dinners and bedtimes than I can count. There is not one part of my personal or professional life that has not been made harder over the last 9 months. And I'm not alone with this. All of us who work in healthcare, whether it's public healthcare, whether it's nurses, whether it's pharmacists, housekeepers, or cafeteria, we are struggling. We make sacrifices on a daily basis to care for people in this community. And to have this one simple ask of wearing a mask to try to make our jobs a little bit easier turned into a legal and political battle is breaking my heart.
Thanks, Cassie. I think a lot of us probably feel the same way, but.
Well, that's the same. We appreciate your help with the community, but that's the same sacrifice that a small business and a family owner take every single day as well. We do work holidays, we miss birthdays, we do all that stuff as well. So, we're all in the same boat, different. All in the same water, different boat.
The healthcare systems are being overwhelmed. They are talking about adding extra beds and extra ventilators, but if you destroy all the people at the end of that, there is no one on the other end to care for you. So I will motion that the hearing officer's recommendations stand.
And I get it. I get that.
Anyone else have anything they'd want to add?
But the small businesses get fined for every little thing that we can't control. Is how do you expect somebody to go up there and tell people that come in, not to wear a mask?
Eileen, anything else that you want to say?
No, I have nothing else to say.
Are we still able to discuss these things off the records because we're being live streamed, or is that impossible now?
probably not possible. Did you get a second on Cressy's motion?
I will second the motion.
All in favor?
Aye.
Aye.
Anybody want to have anything else that they want to add to the discussion publicly?
I would say that there might be a little room for a further compromise, and maybe give the fellow a break now, because it's so hard to run a business. And we can look forward again to another check, and if it goes on one more time, then have less leeway. But I do understand his side of the discussion, and it is a gray zone.
I mean, I can tell you in advance. It's going to happen again.
Okay, well, it looks like the motion carries some weight, so I think we're going to move on. Is there anything else that we need to discuss here ahead of the rest of the meeting?
Not for me, no, thanks.
All right, thank you, Eileen. Okay, I guess we'll move on then to Tanya.
Hi. Okay, yeah, I guess we'll change over to women, infants, and children. I just, we're continuing to.
We're ready. We can go back to Eileen.
John, Tanya is talking.
I think he's having some difficulty. Oops. Okay, so I'll continue. We're doing everything, continuing to hold appointments over the phone, not seeing anybody in the office at this time. One of the things that I will say, the health department situational updates that we get, and the most recent one that included statements from community members, I found that very beneficial. Staff, we talked about it at a morning huddle, just different ways that we can, get the message out to our families as well to help support all the work that you guys are doing. A little caseload update. Last September, we had 1,356 participants enrolled. That's about 90% of our 1,500 goal. Of those, 1,226 were actively participating. So it's about 90% of those, so that's good. Our show rate continues to be pretty good. We had 88% of appointments show up in September, over the phone, of course. So our numbers are still looking good. We're continuing to enroll new families, working on different ways to get the message out that WIC is still open. Trying to work a little bit more with the community, with Healthy Families and Nurse Family Partnership not functioning right now. We've kind of seen a loss in some of our referrals and sort of a gap with our families needing more support at home. Thankfully, there's the ABC Early Childhood Coalition group that meets, and we continue to meet. So just trying to work with other agencies like Cuga centers to sort of help fill that gap with in-home services. So it's just nice to hear what's going on in the community and find other ways to work with agencies. We're continuing pushing forward with our breastfeeding goal to increase training. Dr. Archer, I know one of your nurses has been in contact with us, and hopefully she's going to be able to join us for some of those trainings. We've got a contact at Auburn OBGYN. One of the nurses there is sort of helping us facilitate the pump program that we have, so we can make sure that women who need pumps get them. And I think that's sort of all I have. I know you guys probably heard that we are planning on moving to a new space, which is very exciting. And hopefully that's still moving. Well, I mean, it is moving forward, yes. So hopefully I'll have more updates soon. And that's all. Thank you.
Thank you, Tanya. All right. Does anybody have anything else for Tanya? All right, we'll go back to Eileen.
All right. So there were a number of consent orders. So basically, they all were all signed, and they all paid a $50 penalty, and they all had to do with people, not either employees or customers, not wearing face coverings within these stores. So I'll just go through the names of the facilities, and there were 3 additional that were just emailed out yesterday. So I'll do these all together at once. So the first one is the Original New York Pizzeria. The next one, Moe's Southwest Grill, the Lock Auction Mart, Modern Market, that's in Moravia, Kinney Drugs in Auburn, Frosted Nickel in Auburn, and then the ones that were just sent out yesterday, Burn Dairy in Auburn, Blondie's Corner Store in Auburn, Mama Maria's New York Pizzeria in Auburn, and Aldi's in the town of Aurelius. And then there were a couple of hearings I can go into. So there was a hearing with the Powers property in the town of Block, and this was kind of complicated. A father and a son owned adjacent properties, and the wastewater from one property was discharging on another property, and the wastewater from the wastewater from the different properties were impacting the adjacent properties on this father-son 2 parcels. Don Powers did attend. Mark Powers, his son, did not attend. And it was determined, the finding of fact was yes, there were numerous sewage overflows on these 2 properties. And the hearing officer's decision was that they should be fined $1,000, ordered to hire a design professional and submit engineering plans to install or repair the septic systems within 30 days, and then have it installed within 60 days of our approval, and all but $100 of the fine would be suspended if the repairs are completed as ordered. Another hearing was the Dennis property. They had a failing septic system, Mary Dennis. She did not appear at the hearing, and the hearing officer ordered that she should hire a design professional and submit engineering plans to install the septic system within 30 days, and then install it within 30 days after approval, and all but $100 of the fine would be suspended. Then the next one is the Grinnell property, where they did not do their inspection, septic system inspection as required. They did attend the hearing. The hearing officer said they should be fined $1,000 and have the septic system inspected within the next 30 days. And all the fine would be suspended if the inspection is conducted as ordered. And then the final one is Marshall Family Associates. They had a failing septic system at their Pit Stop store in the town of Genoa. They did not attend the hearing, and the hearing officer's decision was that they should be fined $1,000, ordered to install the septic system that has been approved by our office already, and all but $100 of the fine would be suspended if the repairs are completed as ordered. So that's all I have for the hearings.
In regards to the face covering violations, we do a $50 at the initial and then $500 at the second, and this is up to a max of $2,000. Is that correct?
No, what our policy had been that we talked about is the first time would be a consent order at $50 if they sign the consent order. And if they didn't, then we would summon them to a hearing. And once they get to a hearing, we would request a $1,000 fine. So I did request a $1,000 fine from the hearing officer, but he felt that there was just some complexity due to the fact that Mr. Moon said that these are cousins. They hang out all the time together. They don't live together, but they're employees, but they're also cousins. And so I think that there was some questions, and that's why the hearing officer reduced the fine to $500, but we did request $1,000 And 1,000 is the maximum per violation that we can fine them.
Eileen, I've got a question, and that concerned my question that I had for Mr. Moon was exactly what sort of educational component was provided to that business, because I think that's really important. To, you get the first one, but this is sort of a warning that you need to do better. And I just want to, and I understand that boy, things are really kind of overwhelming, and nothing is ever going to be perfect. But I just want to make sure that we're very, very clear in how we communicate the importance and the intent.
Oh my gosh, I have been on the phone with that gentleman so many times over the course of this COVID. I've talked to him numerous times. We have received, and actually we're scheduling another hearing for a violation that we, found again at his store. So he has been provided a lot of education from me personally.
Well, I appreciate that. That's it certainly settles my mind. I understand someone disagreeing and deciding to do as they wish, just as long as there's no confusion as to what our stance is.
So, going forward, the next violation would be the $1,000 fine?
That's what we would ask for, yes.
I think it might be obvious that I would support that, so.
Well, I'm going to suggest that we make a motion to accept the claims unless somebody else has more to add to the Ed and Jean's violation.
I will motion.
I'll second.
Any opposed? Okay. Thank you. Thank you, Eileen. All right, we'll move on to Kathleen.
You're muted.
Okay, hello everybody. So, what's new that I can tell you that you don't know already? I do like, and I appreciate Tanya mentioning, it was really, we received a number of positive comments from the personal quotes and comments that other than health department people shared and was published in the paper. So we were happy about that, or published online. I don't know if they were all published directly in a paper. I think the diagrams have been helpful, illustrating how easily and how quickly the COVID virus is able to spread. So I'm really pleased with that. Nancy can probably speak a little bit more to this, but we've started up the ComCare system. There are challenges to doing that for different reasons, right? It's the whole state's using it, so the system itself sometimes moves more slowly than we want it to. It's a different way of operating, but we seem to be addressing it. But our numbers are such that we are just exploding, and not enough hours in the day to follow up with everyone as immediately as we would like to. So there definitely are some days of delay at times. We're trying to learn what reports can be generated. That was part of where I was going when I spoke to the education part. The way the system is set up, it's not a simple query. It has to be input in a certain manner, apparently. So we'll see what it can generate for us. And the reports may look a little different moving forward, but more to come on that. Really looking to figure out how to expand our staffing to to address this, we've been able to hire on some contracted people. We have another group who will be oriented beginning Monday. And that's helping, right? That's helping. It's not enough yet to give the relief that we would like to have for our full-time staff. We work toward that.
Kathleen, is there anything you need from the board? Anything we can do to help you out in any way?
Send over people who you think, get the word out. If you think there's skilled people who would be good contact tracers, case investigators, I would say have them, send their resume to Deb English is helping vet them for us. She's working with us. Some of you may remember her from working at the Cuyahoga County Nursing Home. So that's something. So then we have a little more span that way. I think reminding people, those of you in clinical practices, because sometimes there's a delay in getting results, continue to do if you don't feel good, stay at home, right? I think absolutely reinforcing that it's not a joke. The preventive measures that we have, it really is helpful. And I think some of the proof of that is that we have not seen student-to-student transmission in classrooms, right? The children in the schools are wearing their face covers. And yes, there have been instances where a positive student may be at school and the class may be quarantined as a result, but we haven't seen additional positive cases emanate from that circumstance to our knowledge. I'll try to think of it. We certainly, it was great that you were able to offer a quote, Dr. Kosachev. I mean, these meetings are really helpful because you're all very attentive and you're paying attention. I know a lot of times we look to pass on maybe a December meeting, but I'd like to keep meeting because we're still in this public health crisis, right? And you've been very helpful to convene when we need you to. So right now I can't think of anything tangible, but I appreciate it.
Kathleen, what are you thinking is the turnaround time between getting a positive case and finishing the contact tracing process? Are we looking at, how long are you looking at this point?
I might ask Nancy to speak to that one. I think we try ASAP to speak with to do the case investigation with the initial. It depends how many contacts they have, right, and where they've been. So it could be 2-3 days, depending on how many contacts people might have.
A similar question before Nancy answers that is, it's gotten really busy lately. How close are you to the point where the system totally collapses? Are you anywhere near that point where it's just going to blow out and go exponential and you just can't deal with it? And if so, is there any provision for prioritizing who gets traced?
So that's a good question. We do. So I would say we hit the wall when we were not able to call every positive person in a day. To me, that was our tipping point, right? And the only way to address that is to be able to expand our capacity, which we're in the process of doing, because there's only so many hours in the day and so many people who are trained to do the work. We are trying, the state, we say, hey, state, we want you to do the contact tracing for us, right? We'll be happy to send it to you. But they're limited in what they can accept right now. They can take 20 contacts a day, and we have, 100 a day, right? So it's a drop in the bucket, but it's something. We do prioritize school children. We prioritize first responders and healthcare workers. Then we look at work settings next, because we figure this is where we'll have the most control to stymie the spread further. And then we go to the isolated incidents. So that's kind of our priority and how we address when our staff look at who came in as positive. One of the first things they do is take a look at the age, because if it's a school age child, they kind of bump up to the front of the list.
But the elderly are very vulnerable too.
Absolutely.
And the school kids don't, I think a lot of them have it and don't even say anything about it. Or they don't get that sick. They just chalk it up as a sniffle, because I've seen that. And you wonder if they ever were COVID, but they don't want to make a big deal out of it. And the parents say, well, I'll just stay home today because you got a sinus infection or you got a sniffle, or and a lot of those probably slide under the radar anyway.
No, actually, Brian, they don't, because as soon as the parent calls them out from school, they're in my office because they can't go back unless I get a note or a COVID test.
Really? Okay, I didn't know that.
Yes.
So anybody with a really anybody that with a seasonal allergy has to go see you before they can go back to school.
Anyone who checks the box that is a COVID symptom, which you are well aware is everything, needs to be tested or have an alternative diagnosis, which is a real diagnosis, not a sinus infection, but strep throat positive, flu positive.
Yeah. Another piece of the picture here is that a lot of families where allergy seems to be an issue, a lot of those families have actually chosen to homeschool this season because of the thought that every time the kid has nasal symptoms, they're going to end up having to go get a corona test. So a number of my patients have basically homeschooled this season. So if they end up getting sick, you may not hear anything from them unless they get really sick, and they're going to fly under the radar.
Yeah, and that's what I was going to say, because I think this, Keith, I think Cassie and Brian are both right, because if someone's in school and they're sent home with a sniffing sniffy nose, I don't think that's right, but sent home with symptoms, they have to get a test and get, just as Cass is saying. However, if the parents just keep the kid home, till the symptoms pass, or keep them home for a day, then they wouldn't necessarily see a physician, nor have to get the test. So it's I think it's probably both.
I will say I have a child in the Auburn district, and that child didn't go to school one day. I had a health person from the school district call me before the end of the school day to say, why is your child home?
Really?
And what are the symptoms they have?
Wow.
Yep.
They must have more staff than they need.
No, I think that's great. It was after school hours, but it was before during my day, right? It was just as the school day was ending, but before everyone had bugged out. So I had said the child won't be in school, but they then followed up to say, why was the child not in school?
Yeah, that's amazing. I don't think many districts are doing that.
I've got a question, Kathleen. I saw that we had a drive-through clinic this past weekend, which was great. I know we've had issues with testing. What sort of response have we received from the health department, New York State Health Department, in regards to assistance with that?
Yeah, good question. Thank you for asking that. So I know Nancy's been working really hard to try and make sure that we can do at least one symptomatic drive-through clinic a week and on the weekend, right? In addition to what's available in the community and outside the community. And we are also looking at contracts with other entities potentially to expand that. But we have been asking New York State Department of Health for supplies. We know the hospital has shared with us that reagent for the Abbott ID Now is a premium, and that's their PCR-based fast test. Now, it's different than the antigen-based Binax card. We have gotten some of the Abbott ID Now reagent from the state. We've had a couple different shipments, and we've gotten numerous Binax cards. And so what we are doing, we had hoped to have something today, staffing wise, that didn't work, but we hope as soon as next week to have some routine asymptomatic testing available for the community. And we'll use these Binax cards, which are the 15-minute antigen-based rapid test. And we hope that that will provide a level of additional testing for people in our community that can be helpful to catch people like maybe these kids
maybe these school kids. Yeah. So who pays for these tests, Cass, when they have to come see you with the snotty nose?
If I am able to provide a diagnosis. As I understand it, insurances are covering. I've not gotten any pushback in regards to that. Screening tests may be out of pocket, and the fee that I am told that is provided by the hospital is not that bad. So for example, from a screening test, if you had a contact and you wanted to get tested, or you wanted to see your mom in the nursing home and you had to have a test prior to that, no symptoms associated with it, that would be a screening test. But I've not gotten anyone. I mean, I've had people with 3 or 4 COVID tests, and they have not told me that I've not heard complaints about a bill.
Dr. Archer, or Kathleen, the Binex card is considered a screening test, and the results are processed without a lab. You just get the results at point of care. Is that how it goes?
Yes.
The Binex. Oh, sorry, Kathleen.
No, please go ahead, Dr. Archer.
Okay, so I would say a screening test would be defined as doing a test in a patient without any symptoms. Okay. And it does not require a lab, though. I believe the hospital lab people are doing it because they feel there is some concerns that they are not as accurate, and the people at the hospital lab feel they can increase the accuracy by doing it in their lab.
So you're right. So on Wednesdays, Auburn Community Hospital, the last few Wednesdays, has been performing this as a drive-through service. And so we've been working closely with them. We supply the goods and have been doing the scheduling, but we're looking to try and create some more efficiencies, because really we want to do all we can in the department to not perform work additional, right? If it's something that can be held more efficiently and others can perform it, we want them to. So what we're looking at with a community thing is to have our emergency management office partner with us, and ideally use some EMTs to do the performance. And yes, someone will walk away with the answer with the positive or negative, kind of like a pregnancy test, right? And they'll have a form that's official that they can bring to the nursing home, they can bring to their work site, they can bring wherever it is that they might need to have proof.
So what makes it, to your point, or to Dr. Archer's point, a screening test is it's done on an asymptomatic person. But there's a screening test the hospital does for asymptomatic, and then there's the Binex, which is different, right?
Binex is the same as what the hospital's doing. The hospital is doing their analysis through their laboratory. We'll be doing it on site like a school would do if they had not.
Okay.
And we do have to operate under, and Dr. Joya can speak to this because we had some conversation over it, under our limited service certificate, the limited service laboratory certificate, and and we had to have our CLIA waiver adjusted to account for these particular tests.
So the only difference is one's done in the hospital, the results, and the other will be done on site at the clinic site. Yep.
Same test.
Okay.
And we are giving the test to the hospital to use. We'll be using the very same ones in the community outreach.
Yep. Oh, thank you.
Is the Binex more accurate than the Abbott?
No.
I've got a follow-up question, Kathleen. In terms of the labs, what is the turnaround for the results? Has it gotten any better?
I don't think it's gotten any worse. About 3 days. Yeah, please, Dr. Archer.
I can speak to that. So the tests that are done at the hospital, either through the hospital in the emergency room or their urgent care centers, are they're doing those tests in-house, so they're seeing same-day turnaround or 24-hour turnaround for those. In our office, they're still sending to LabCorp the majority of our testing, unless we have a patient who specifically needs rapid results. And I'm getting those back within 2 days, so it's not bad.
Good.
Oh, that's great. That's much better than it used to be.
Though, again, we cannot make any guarantees. I can't say what's going to happen tomorrow.
That's better than I had expected, because with coronavirus numbers going up as quickly as they've been in the county and all over the place, I sort of expected the delays to the turnaround time to be increased more than that.
Last question, Kathleen. So you're saying the Binex cards that are potentially going to be done through the county health department, those particular clinics will be starting fairly soon, or once a week, or is that the plan? Or
We're not making a public announcement till we have the personnel in place.
Okay, no,
that's why I was a little vague.
Okay.
We hope to have them multiple times a week.
Oh, all right. All right.
Very good. Does anybody else have anything else for Kathleen? Thank you, Kathleen.
Thank you.
We'll move on to Nancy.
Good afternoon. I'm looking at trying to address some of the questions and several of the comments that have been presented here. So I'll start with our prioritization of children. That is a priority. There's a couple reasons for that. One, we're trying to keep the schools open. We're trying to get information to superintendents rather readily so they can make some critical decisions. So that's the reason for that. Secondly, because of the increased numbers, what I've seen is it's become more personal. People now are really, because it is in their homes, in their neighborhoods, in the places that they visit in their community, within their schools, etc. So it is becoming more personal, and therefore more concern expressed. We have a cubicle wall that we have turned into a telephone. It looks like a Jeopardy board with columns and the whole 9 yards to take in all the phone calls that come in here in a day. And we can't even answer them all within a day. We can't quite master that. We certainly used to be able to do that. We can't, but we do get back to them. We do find a way, and it may be several days, and it might be a call that I make and follow up. And they usually are very appreciative that there was a response. Another important point that we're expressing every day, all day, which I think is one of the most difficult pieces right now is, and I know some of you, I'm talking to the choir, we've experienced all the symptoms of COVID in other health issues, other illnesses. And now, because of that, people, all of us, are finding it very difficult to determine whether we're dealing with COVID or we're dealing with, I've got allergies, I've got sinuses, I've got a cold, and people are also thinking about what they see on TV, all the critical cases. They're thinking that's how they're gonna start out with COVID. No, it's the meek and mild symptoms. And that's the most infectious day. So we are teaching that all day long. And why it is such that people can't go to work and people can't go to school. When specifically with the allergies, it's an interesting one. And now we ask, have you been diagnosed? Yes, people believe they have allergies, and they're many times may be correct, but they need a diagnosis of allergies. We had a nurse that lived in this county, works in a different county. She's very familiar with her fall allergies. She checked into work every day, was afebrile, stated she felt okay. Her nasal congestion or mild case, she attributed to her allergies. She was tested weekly in that facility. She tested on Monday, got the results back on Friday, and she was positive and had worked all week. So all these symptoms is why we can't dismiss them, because that's the most infectious day. When it comes to ComCare, I guess I'll answer it with a question. Why am I here? It has been a challenge. Some really smart minds around the topic. This program out of Boston has been around for 10 years or so, hasn't done COVID work, but they have launched similar systems. Upstate New York is the portion of New York that is using ComCare. It is, I think at this point, all of us would agree that are using it, that we're glad we waited. It's a terrible time to go up on it with the number of cases we have now, but they have built out so much since April, which is to our benefit that they have built out. But there still isn't a playbook. They're canned reports, which typically when you go live on any of these systems, you start out by using the canned reports, and then you can get sophisticated as you get acclimated to the system. But no, the canned reports have not been updated since March. So they at least are forthright with us, don't use them because they're not current. So it is creating your own report. So we're trying to find our way through that. What, as far as the time element and the turnover, we were at one time, even if it meant we were working 10, 12 hours, we were finishing everything on the day, that day. But now that is not possible. That is not possible. And we're trying to, and it's not perfect. I'll tell you, it's not perfect. We're trying to prioritize, but even that falls out because you get a lot of different calls of inquiry about a certain case. And it's a challenge. So where we are right now is kind of the same place we've been right along, but every conversation counts. And that's what we have to make of value. So, and hopefully that one person will tell 3 other people. We try to make every conversation meaningful because the amount of work is really a challenge. So, and ComCare is a challenge as well. And I think the state has appreciated the team we've put together and the questions we've had for them, and their ability to return a phone call. I'm sure they're inundated too, so we don't get timely responses. So you're kind of, fortunately, some smart minds around here trying to make our way in all of it. As far as the clinics, yes, we're trying to put them up. It will alleviate offices, ERs, the urgent cares, having clinics, drive-bys. So that has been a challenge with staffing and sometimes supplies, but it's good. Any questions that one more comment before. We're dealing with, in all of these businesses, small or large or in our homes, what worked before are successful businesses, the way we did work, the way we lived, and now we're changing it all up. We're changing it in our homes, we're changing it in our businesses, changing it in school and healthcare. That's right, we have to. And we have to help one another. And I've sent the message to everyone. We tell our clients that we need to help each other. If they're in quarantine because they've been in close contact, we need to help each other, because when we identify any of those early symptoms in our colleagues or ourselves, we need to help one another say, you know what? You've been sneezing for the last hour. You've been blowing your nose for the last hour. I think you need to get out of here and get a test, Nancy. So that's the kind of conversations that we're having throughout the day.
Thanks. I can imagine the workload you guys are straining under. It's very much appreciated. And also, if there's anything the board can do to help you out, let us know. I'm going to go back to Kathleen because there's something that we need to act on as a board.
Yes, thank you. And I apologize, I'd forgotten to mention it. You had received kind of an email last Friday, I believe, that Megan Bell sent out. As many of you are aware, at the end of October, the town of Owasco and city of Auburn did pass resolutions to move forward an updated version of the Owasco Lake Watershed Rules and Regulations. Our rules and regs had not been updated since 1984. We're excited about that. Many of you here have been involved in this process since its inception, and certainly all of you have heard about it at our Board of Health meetings. What we would like for your consideration, and I believe you saw a draft of the resolution, would be to see if the Board of Health would like to support the watershed rules and regulations supportive resolution to accompany what we send through the local health department to the state health department for consideration. Eileen can probably speak to it, but I believe our Wasco Lake watershed group, Eileen, are you still on? Did they put together a resolution of support as well?
Yes, they did. And also some other lake associations put a resolution. The Cuba Lake Intermunicipal Organization, some other groups have.
And I'm thinking we may have one may come from our State Association of Health Departments as well, but certainly we think it would add positive impact if our local Board of Health is in support of the watershed rules and regulations and having them updated.
I would motion for that, for the Board of Health to support the revisions to the rules and regulations.
I'll second the motion. Anybody else want to say anything? Anybody opposed?
I know that was a long, huge road. Eileen, you probably spent an hour or two on that one, didn't you?
Yeah, I think maybe.
It's been 3 years now, because it's been every bit of 3 years, hasn't it?
Yeah. Kathleen said, "Oh, a year. It'll be sure. We'll get them before the end of the year."
That's probably about right. Triple it.
Sure.
It's heartening to see how everyone is lining up with their support, and it was disappointing this year, especially for me, just how the shape that the lake was in, especially starting, from August forward. We can't continue, destroying our resources like this. So I'm hoping this has a positive impact, and it's nice to see everyone really feeling like they are supporting it.
Well, we certainly appreciate the unanimous support from our Board of Health. It's a big deal. So thank you.
Kathleen or Eileen, do you have any indication of how long it'll be at the state before it's approved or recommended? Or, I mean, that could be another lengthy process.
Yes, it could. And also, I haven't even sent it to the state yet. I haven't had time to put everything together. So I'm hoping to get it there or at least shipped out of my office by the end of November. But I would imagine it's going to be at least a year. I can't imagine it may be longer. I don't know.
What I'm wondering, is there anything, I'm not sure what the board could do, but maybe all of us as citizens to try to provide, our support through our elected representatives to ensure that they understand how important this is to us?
I think that's a great idea. Yes, when we send it forward, maybe, Eileen, we can send our board the finalized version, and we'll send you, I think you saw a copy of what we'll send as a resolution, but those would be, you'll have that in front of you, should you choose to reach out.
That sounds like a great idea. Okay, well, thank you. Should we move on to Dr. Joya?
Hello. Yeah, not too much to add. Seems like the Binax looks like a good system. ComCare gets good recommendations by Johns Hopkins. That's a nice thing to know, but it's may not be the perfect, but it's one of the better systems out there. the vaccines are certainly, hopefully, will be a nice chore. Will be trying to help get those out, maybe as early as mid-December, end of December, definitely by February. Probably going out to healthcare workers, make sure that they at least keep the healthcare staff in good shape, and the high-risk people. It's probably after that, and then probably won't be a while before we got to worry about general public clinics. Probably won't be enough vaccines till probably like summer, even hopefully before next school year.
I'm assuming that the Board of Health is going to receive direction from the state as far as distribution of the vaccines once they're available.
I expect we will. We've received as a health department some information about the prioritization. I think people have probably seen that in the newspaper and such. And we were requested to update and send forward a vaccine distribution plan to the extent we can, based on what the parameters of the vaccines are. Right? We know we've all heard in the news some of the limitations that some types of vaccine might have. So it's certainly a tremendous undertaking that's going to have a lot of direction associated with it.
Okay. Well, I'm sure we'll look forward to hearing more about it. Does anybody have anything else for the meeting today?
I do. I just wanted to, well, this is related to the article that I read. Keith, I did not realize that you were ill. I'm very happy that you're feeling better. I read the article and I thought it was a great way to really personalize this issue and really show everyone, how it can impact a person and a family. So thanks for that, and I'm glad you're feeling better.
Very good. If there's nothing else, I'll take a motion to adjourn the meeting.
I'll make a motion, Elaine.
I'll second.
Very good. We'll see you next month. Thank you.
Thanks, everybody. Bye.
I think Keith left first. I don't think he heard you, Ralph. Keith left before you talked.
Oh well. Well, I'm glad everyone. I wanted to say it anyways because I was really happy to read that article, and I thought it did a good public service. So I'm glad the rest of us heard it anyways.